from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about the rise in colorectal cancers and the importance of early detection. Our guest today is Dr. Stephen Kucera, the Medical Director of Gastroenterology and Endoscopic Oncology with Sarasota Memorial's First Physicians Group. Dr. Kucera, thank you so much for joining us again. It's been a while.
It has. It's nice to be back, Allison.
We've been hearing more and more about colorectal cancers lately. Are rates increasing or is awareness improving?
No, this is a great introduction to start this little conversation today. Rates are increasing, and it is in a particular demographic, and that demographic happens to be people less than 55 years of age. The most recent statistics are a 3% annual increase in that population. So we are seeing a dramatic increase in colorectal cancer in young folks, to the point where this has now become the leading cause of cancer-related death under the age of 55.
Do we know why this concerning trend of more young people having this cancer is happening? What's driving it?
We don't know. There are, with anything, there's lots of ideas and theories, and there are some things that folks kind of point hats at a little bit, but nobody really knows. To be honest, it's probably a combination of a lot of things. It seems to be driven in the Western world, so it seems to be things in civilized nations that we're seeing this dramatic increase. Obesity plays a factor. There's a lot of discussion about diet, although evidence behind that is difficult to really pin down. So it's probably a factor of a lot of things.
So when we talk about colorectal cancer, just to be clear, what cancers are we talking about?
We're talking about cancer in the large intestine, which is the colon. Begins and ends with the rectum, I guess, depending on which way you're going or coming. But cancers in the large bowel is what we're referring to.
Are these younger patients presenting differently than older patients?
The presentation is the same. When somebody, be it young or old, develops a colon cancer that results in a symptom, those symptoms would be the same if you're 85 or 45. Bleeding, obstruction, abdominal pain, such as that.
So who is most at risk then?
So we all are. That's the statistics about our lifetime risk is somewhere between 3 and 4% of every average risk person on the street. 3 to 4% lifetime risk of developing colorectal cancer. So we're all at risk. Why is this younger generation, why are we seeing more of these cancers in the younger generation? Like we said, we don't entirely know. And so the focus today and the message today is to really kind of hone in on the under the age of 55 demographic and talk about being aggressive in prevention in that range. What's interesting about the statistics is we see this dramatic increase in younger folks, but the colorectal cancer incidence beyond the age of 65 is actually declining. And that's because screening. Those are that age demographic has been well screened, and beginning at age 50 in their time frame, they've gone through the screening process. So the rates later in life are decreasing because those folks have been involved in screening programs. But it's getting the younger ones in early, I think, is the key message today.
So let's talk about screening. Colonoscopies, we've all heard of them. We've talked about them with you in the past. Such an important prevention measure. How does it look for these cancers, and why is it really important that people find out if they should be getting their colonoscopies?
So to answer that question, we're going to just do a little bit of science. So what we want to talk about is how does a colon or rectal cancer develop? And every colorectal cancer develops from a polyp. A polyp is a generic term for growth in the colon that acquires genetic accidents along its journey to becoming a cancer. And we used to think that pathway was slow and that it may take 10 years. Some of the newer evidence, and especially in some of these newer cancers in young folks, we seem to think that these genetic accidents can acquire quicker and we can develop cancers much quicker. But regardless, even in an aggressive situation, every colorectal cancer starts as a polyp. So in order to discuss the screening modalities, we need to understand that background. Because if we have the ability to identify polyps, remove them, we prevent the sequence altogether. And that's what colonoscopy does for us. That is the gold standard. Colonoscopy allows for detection of polyps and early cancers and elimination or removal of polyps to prevent the cancer altogether. Some of the other screening tests that are available are screening tests for colon cancer itself. So we've heard about the Cologuard tests or some of these other non-invasive tests that use stool samples or blood. Actually, there was a blood test approved in 2024 called CancerGuard, I think, and that particular test is a blood test in which the cells from the cancer, they're picking up DNA sequences off these tumors. So these are screening tests for folks that already have cancer. And so the big distinction in our world is, are we preventing cancer, or are we finding the folks with the cancer? So if prevention is the answer, which seems to make sense it should be, then colonoscopy is what we need to do. If detection is the answer, then the non-invasive screening tests have legitimate accuracy.
Why do you think so many people still avoid or delay screening?
I think the stigma behind, stigma is a weird word. I think the process behind having a colonoscopy is intimidating. And I think when we talk about sensitive areas of the body, people tend to say, oh, I'm too machismo, man or woman for that matter. And that's not something I want to do, or, that's an old person test or whatnot. I think since the last time we've had this discussion, I think most young folks can name a friend, a family member, or a colleague or an acquaintance that's been diagnosed with colon cancer. And so I think once what I'm seeing in practice is younger folks coming and saying, I want this. This is not something that I would have ever asked for, but I want this. And it happens to be that, in this demographic, everybody knows somebody now.
Yeah, we've even seen celebrities coming out and talking
Absolutely.
about either getting their colonoscopy, or a friend or loved one having colon cancer. Even some celebrities who had even colon cancer who said, I should have been screened earlier and then I wouldn't have had this. So how important is it that people are speaking out more too when they get that diagnosis?
It's very important. Anything that increases awareness is hugely important. Katie Couric did it for us. Man, that must have been 20 years ago, right? Recently, we saw James Vanderbeek pass from colon cancer, and that awareness is helpful. I think that's just as helpful as us talking about it.
So who should have a colonoscopy or talk to their physician about having one?
So the current guidelines suggest that an average risk individual, that's somebody without a family history of colon cancer or some other unusual genetic disorder, should have their first exam at age 45. So, and still at 45, we're missing a good percentage of people. And unfortunately, there are financial considerations to these guidelines. And so when we apply these things nationally, all of these things are considered. So who should have a colonoscopy? Any 45-year-old individual should have a colonoscopy, period. Or some sort of screening test if colonoscopy isn't the desired first choice for that patient. Additionally, I think we need to be more aware about our family histories. And the guidelines are different. If mom or dad had a single polyp in their life, your first colonoscopy should be at age 40, not 45. So early screening is important. And then if there's a family history of colon cancer, especially in younger individuals, early screening can be even younger than age 40, depending on the details. And I think the other thing to talk about is not ignoring symptoms, in younger time in life. A 35-year-old used to have a little bit of bleeding or something and say, oh, that's not a big deal, I'm going to ignore that. I think ignoring these symptoms is a huge disadvantage. And so paying attention to new symptoms, things that weren't there before, we take very seriously. We don't ignore those. We don't blow those things off. We do a lot of diagnostic exams in folks younger than age of 45. And I'll tell you, we find polyps, we find advanced polyps, we find early cancers in folks that are well below the 45-year-old mark.
And this is a very treatable cancer, especially if caught early or before it's even developed into a
right.
cancer, of course.
Exactly. So we talked about the polyp situation, and so if we find polyps early, we remove those, we prevent the cancer altogether. But if we find colon cancer early stage disease with surgery alone, 98% cure rates. And so if we're finding tumors before they're really developing into big symptoms, the cure rates are phenomenal. The chemotherapeutic agents have advanced. I mean, our treatments for this disease are really impressive. And even when we're a little less fortunate and we find things later, we still do a fantastic job of curing the disease. But it's just heightening all these little things, paying attention to family histories, paying attention to symptoms, getting in and getting screened early on. And to be honest, I think, in my career, we're going to see some sort of non-invasive screening test that is as accurate as colonoscopy for polyps, not just cancers. And that's really going to be the holy grail of this whole screening thing, right? Because when we talk about screening tests in medicine, we like things that are cheap, easily, widely available, not invasive. Colonoscopy is none of those things. I mean, it's available, but it doesn't really tick any other boxes. So if primary care could send you home with a stool test or a blood test that you could do as early as age 30 or 35, I think we cast the net a lot wider. So I think in my career, we'll see some sort of non-invasive screening test we can apply much more widely.
When we talk about things like prevention, you mentioned that there's some question about lifestyle choices. Are there things that young people should or could be doing to prevent colon cancer before they've even reached the age where they can get a colonoscopy?
It's a good question. I think establishing a healthy lifestyle is kind of, doesn't just fit with colorectal cancer risk, but other disease states as well. But if we kind of answer that question in a weird way, we take a look at who lives the longest on this planet. Right? And what populations are those? And those are populations in which an active lifestyle, a Mediterranean diet, and if we look at those little pockets, the so-called blue zones around the world, if we look at those pockets, that's what life is like there. There's regular activity, there's a well-balanced diet that kind of falls into the Mediterranean diet, thing. And we're not smoking, and alcohol is a moderation, not an exaggeration. So these things are important. If we establish these practices early on, it's not going to prevent every disease or every cancer, but it's going to go a long way with our general health.
You mentioned before that the guidelines for colonoscopies had changed to try and capture more. You seem to imply you don't think they've gone far enough. Do you think they'll go further in the future?
I don't know that that's possible.
Okay.
We would like to go further, but on the other hand, you're screening a lot of people that are going to be normal at age 35.
Right.
Let's say we dropped the guidelines 10 years earlier. You're going to catch those cases that really kind of create the shock waves when we have a 37-year-old that passes from colon cancer. Mm-hmm. But the vast majority of those exams are going to kind of fall toward normal. I think the real silver bullet is going to be this non-invasive screening.
What's something you wish more people understood about colorectal cancer?
I think that the very simple thing is that it's preventable. I think when people hear that, they come in. If we understand that this exam is really not a big deal, and having a colonoscopy is not this traumatic life experience that a lot of the hype goes with, and that we understand that this disease is completely preventable.
And even the preparation for colonoscopies has changed. It's not, you don't have to drink 10 tubs of water necessarily.
No, you don't. I'm probably going to get in trouble here, but my wife and her girlfriends all had colonoscopies on the same day recently. And they threw a prep party, Allison. So the girls all came and they made mocktails out of the various different chemicals and laxatives. And the girls sat around and had a girls' day and did their prep together, and they all came. And I thought that's a kind of a nice message. You know what I mean? These preps are really not that bad. And, do it with a friend.
Yeah. There's a new type of party I hadn't even been prepared to think about. If the community remembers one thing from this conversation, other than maybe throwing a prep party, what should it be?
Don't ignore symptoms as early as they may seem. Be aggressive about screening and ask your doctor. I think we've seen a wonderful shift in our primary care network. And I think that shift has been to encourage colonoscopy. And some folks are resistant, and that's okay. Some screening test is better than none. So, ideally we'd be screening with colonoscopy, but we're not going to, turn our hat on folks and say, I just don't want to start with that as the first screening test. So primary care has been doing a great job, but ask primary care when you go in for a physical at age 40 and mom might have had polyps, say, is this, something I should be asking about? If we're aggressive with casting the net, we're going to be aggressive about prevention and finding the early cancers.
So to wrap it up, what are the main symptoms? You mentioned them before, but I want to make sure we emphasize this. What are the symptoms no one should ignore?
Anything new that falls in the category of abdominal pain, change in the bowels, bleeding, but new things. If this is something that you've had for 20 years, it's right. But new symptoms are important at any age, really.
Because it's not worth putting it off, I'm understanding.
Oh, absolutely not. And when we talk about risk benefit, these colonoscopy tests are exceedingly safe. They're quick, they're easy, they're efficient, and just the bang for your buck goes so far with these things.
All right. Is there anything else you want to add before we wrap up?
It's nice to be back. It's always fun to talk. It's good to have these conversations every couple of years. Technologies change, testing changes,
Absolutely.
but the message doesn't. And so as long as we're being aggressive about prevention and awareness, I think we're gonna get a lot of folks.
Dr. Kucera, thank you so much for joining us again.
Thank you.
And as always, we encourage everyone in our community to visit smh.com/podcast to hear more experts like Dr. Kucera talking about the health issues which matter most to you. And to get the latest from Sarasota Memorial, visit smh.com. Have a great day.